Hi, my name is Mazatul Adila binti Naspu. So for this video, I will demonstrate on how to do episiotomy. Selamat petang puan, my name is Mazatul. I will be the doctor in charge for your delivery today. So I can see that your baby's head is already at your vagina. This requires me to make a small incision at your vagina to make the delivery more easier. After I make the incision, after this I will stitch back the incision. Is that okay, madam? Yeah. So episiotomy is when we do a small incision at the perineum area to make it easier for us to deliver. Indication to do episiotomy includes when fetal distress, baby malpresentation such as breech presentation, macrosomic baby, shoulder dystocia, and for assisted instrumental delivery. Episiotomy should be done in the aseptic technique and patient is in lithotomy position. During the fetal head crowning, I will inject 5 ml of 1% lidocaine beneath the skin and the vaginal epithelium to ensure adequate pain relief for the patient. The effect will develop within 5 to 10 minutes. After that, I will insert my index and middle finger of my left hand into the vagina posteriorly, separating the perineum from the fetal head. This is an important step to protect the fetal head. Next, I will insert the episiotomy scissor and direct the scissor to the patient's right, 45 degrees away from the midline. I will only start the incision during the contraction when the presenting part is at the perineum. Okay. I will do a single cut 3 to 4 cm in the medial lateral position. If I start the episiotomy too early, it will cause severe bleeding and difficult to access the perineum.
To repair the episiotomy, patient should be in lithotomy position with good lighting. Before that, I will explain to patient that I'm going to repair the incision. Before I start, I will inspect the perineal tear and identify the apex. Next, I will start suturing, in which the suture should begin 1 cm above the apex. For vaginal mucosal epithelium, I will use continuous suture technique with absorbable Vicryl 2.0 suture. For perineal muscle, I will use interrupted suture into the muscle. The aim is to bring the muscle together and to eliminate dead space. When suturing the muscle, I need to take care not to suture through the rectum. When the muscle has been correctly sutured, the skin should be lying closely to each other. For perineal skin, I will use absorbable suture with cutting needle to repair the perineal skin. It can be done by continuous or interrupted technique. After the suture is done, I will do per rectal examination to ensure that there is no suture felt in the rectum.